Welcome back to the morning show here on Channel 18, and our next guest is also a key sponsor, Middle Park Medical Center. We can't do this show without great contributors like you guys. So with me here is Robert Flake, the CEO of Middle Park Medical Center, which is an extremely valuable part of our county, both from getting sick and needing clinics, and also we're pretty recreational enthusiasts up here, and injuries often happen, and it's kind of a rite of passage to most people to spend a little time with you guys throughout their tenure in Winter Park. So, Middle Park Medical Center, give us the overview here.
Yeah, so Middle Park Medical Center, we're a critical access hospital. We have multiple locations. We've got a hospital in Kremling, a hospital in Granby, and physical therapy in Winter Park. We also have physician clinics in Kremling, Walden, and Granby.
So you've got a nice umbrella there to spread out.
It's a large population.
What is critical care, is that what you said?
Critical Access Hospital is a smaller hospital, less than 25 inpatient beds, and allows us a different reimbursement under Medicare and Medicaid plans.
And there's been some growth with the Middle Park Medical Center. It's seen quite a bit of growth in the last 5 to 10 years.
Yeah, so the Granby facility has been open for about almost 5 years now. Brand new facility.
It's a huge upgrade. Yeah. We had a small emergency clinic in Granby before, but this end of the county, we didn't really have a good option. It was a long drive to Kremling or Denver.
Yeah, so the Granby facility is over 20,000 square feet. It has 2 operating rooms. It has about 6 emergency rooms. It has 2 inpatient beds. And then we have a primary care clinic there. We have a specialty clinic there. We've got imaging services, all you can imagine. We've got MRI, CAT scans there, DEXA scan and mammography. We've got a lab. We've got physical therapy. And
I mean, this is a state-of-the-art, it is a beautiful building.
It is a beautiful building.
So you said it's about 5 years old?
About 5 years old, and it's probably too small for us already.
How fast, things are, especially these days, things are booming up here, and the medical industry as well.
Yeah, and our busy emergency room days, we're seeing over 30 patients.
And you brought way more services to this end of the county, which is so fantastic for all of us that live on this end of the county. It's been a wonderful addition. So financial health, you built this 5 years ago. We all know what the economy was doing, and even our local economy. We had kind of a purge at that time of residents.
Yeah, and so Middle Park Medical Center has gone through some difficult financial times. We're coming out of that now. When we built the new facility, we did borrow quite a bit of money. At a very high interest rate. We've refinanced that in the last 6 months. We're saving about $500,000 in interest expense a year.
Alone.
Interest alone.
$500,000.
Yep. And our other financial struggles were with our billing system. We had outsourced billing, and the expert company that was working with us wasn't doing a very good job. We've brought that back in-house about 2 months ago, and we hired a team of 6 individuals with over 100 years of experience in medical and healthcare billing, and have turned that around.
So these are the guys that I might go for an appointment. It goes on to my insurance, and then I get a bill to pay the difference.
Yeah, so they run that whole what we call revenue cycle, the collection of all the information from you related to what your healthcare issue was, what we did for you, added your insurance information with that, and sent a claim to the insurance company, worked with them to get that paid, and then we'll then send a statement out to the patient for their portion of the bill.
And I don't want to focus too much on Granby, because you do have the nice facility in Kremling and elsewhere as well, but a lot of our viewers are on this end of the county.
Sure.
How many doctors would operate out of Granby?
Well, so out of Granby, on any given day in our primary care clinic, we have 4 providers, whether they're physicians or mid-level providers. We've got 4.
Mid-level would be a physician's assistant?
Or nurse practitioner.
Okay.
And so that's the primary care clinic. The specialty clinic, on any given day, we probably have 1 or 2 providers there that are visiting us from Denver, from Summit, or from Steamboat.
And these are the kind of satellite doctors that are coming in for 1 day a week or every other week? Or?
Yeah, 1 day a week, 2 days, a couple days a week. And they range in services. We got orthopedics that come down 1 day every week right now.
Those are our favorite ones around here. We have bone breaks and MCLs and ACLs and this and that.
Yeah, and so we are making a heavy investment into orthopedics, and what we hope to do before the ski season starts is have an orthopedic presence every day of the week. We're looking at having a surgeon on site 2 days a week, and a mid-level provider, a PA that specializes in orthopedics there the other 3.
So we are considered rural up here, and so this is just amazing facilities to have for a rural area.
Yeah.
It's wonderful, all the different doctors you guys can bring in.
Yeah, and so we do orthopedic cases 2 days a week right now. Last year we did about 250 orthopedic surgeries, and I think that's something that a lot of people don't realize, is that we have the surgical capabilities in the Granby facility. And actually 2 months ago, Dr. Bomberg did an inpatient case where it was our first inpatient orthopedic case.
You know, I don't want to cut you off. We got to take a quick break,
Sure.
and maybe we'll talk about this when we come back.
Sounds good.
Once again, I'm hanging out with Robert Flake, the CEO of Middle Park Medical Center. Definitely check him out on the website, mpmc.org. We'll be back shortly on Channel 18.